absolutely beautiful day. Even though Dr. Ajagbe said it's 85 degrees or 80 degrees.
80 degrees.
80 degrees. It felt like 60 to me. I was cold, but it's Monday. Welcome to Medical Mondays with Dr. O. I am Dr. Toyin Okpesomi, a family practitioner, HIV specialist, and I treat substance use disorder in Maryland. We on this platform love to discuss how to prevent disease entities and how to live healthier. I'll say that over and over again, life. Obesity has become a problem. It's now a disease, according to all research and all we know. In order to curb a lot of things that could occur adversely in our health, we need to maintain good weight. So we have tonight one of our very own, Sister Sylvia Tchuindjo. She's a nurse practitioner, family nurse practitioner, who are focused on obesity as all she does. She focuses on helping people to get into the normal weight they should get into. She's very experienced, has been a nurse practitioner for years. And we are honored to have her tonight on Medical Mondays to come share with us how to prevent this dangerous disease called obesity. So, Sister Sylvia Tchuindjo, kindly come on. The floor is yours.
All right. Good evening, everyone. Thank you. Before I can start, I'm going to give the honor where the honor is due. So if you guys can help me honor Dr. O, because it is a privilege and an honor to be speaking here tonight. And I really appreciate all that she's doing for the community. So I just want to say thank you, Dr. O. Thank you. Tonight, I'm hoping that it's going to be very interactive where we can learn from each other. So I have some slides here that I prepared. It's very broad, but we're going to have more questions and we're going to talk about it. I'm going to start by asking what's obesity. Obesity is a chronic, progressive, multifactorial, neurobehavioral, wherein an increase in body fat promotes adipose tissue dysfunction and biomedical stress on the body. This dysfunction leads to adverse metabolic, biomechanical, and psychosocial health consequences. In addition to reducing quality of life and lifespan, without treatment, obesity is likely to progress and worsen, further increasing the patient risk for numerous health conditions caused by excessive weight gain. Based on this definition alone, we can see that how important it is that we should be very careful in approaching individuals with obesity because of their relapses. Sometimes you hear people saying, I have been dieting, I lose the weight, I gain the weight back and things like it because of the complexity of the disease itself. Clinically, obesity is defined as a condition that a person has not a state of being. Because sometimes, if I'm going to talk about provider, it can be very difficult to approach someone with the disease of obesity because it has not been accepted as such. Compared to diabetes and hypertension, where people are used to know that, okay, they can use medication. If they don't do it, maybe they're going to have neuropathy and things like that. Obesity is not. But we all know that it is a root cause of all of these diseases. Now, it is important for us to treat it, those who are providers, to really find a way to approach this topic with their client, because it is a culprit of diseases such as hypertension, diabetes, PCOS, dyslipidemia, sleep apnea, anxiety, GERD, depression, abnormal LFT, and more. So treating obesity will not only save the US from billions of dollars spent yearly on healthcare, but we provide a better quality of life to our patients. And that's what is really important, the quality of life. Things that can be preventable, we must do our best to prevent it, even on an individual basis. So how to approach obesity management? We're going to talk about traditional versus the newer method. The traditional method of treating obesity, we talk about the calorie balance, calorie out, calorie in. The simplified approach that energy is a balance between calorie in and calorie out, and that excess calorie are stored as fat to an excess of circulating fuel, meaning that's what we use for fuel. Now, this method lends to encouraging patients to reduce calorie while maintaining nutritional need. It has worked for some people, but this is also the reason why we see a lot of yo-yo diet. With a better understanding of hormonal influence on appetite and fat metabolism, many providers are focusing more on the type of calorie rather than just the total number of calories. When I talk about the quality of calorie, we can dive into maybe talking about what we call macronutrient, which macronutrient include the carb, the protein, and the fat. How much do we need? As we're losing weight, how much do we need so that our eating, our nutrition is well balanced? The newer model, which is the hormonal model that I was trying to explain. The hormonal model, often referred to as the carbohydrate insulin model, state that energy storage, which is the fat mass, is controlled by hormonal signal, which is the insulin, that regulates lipogenesis, which is a creation of fat, versus lipolysis, which is the breakdown of fat. The argument is that high insulin level, primarily from the consumption of carbohydrate, reduce the availability of circulating fuel because insulin is a storage hormone, leading to hunger and thus increase energy intake and decrease energy expenditure. Now, this model goes a little deeper as to why some people end up eating at a surplus calorie. We go here. Okay, but why the differentiation, the importance of insulin in obesity? That's really critical. It is critical to recognize that insulin resistance leads to hyperinsulinemia. And when this happens, insulin remains high even during fasting, basically locking the individual into a fat storage mode without access to their own fat as a fuel, meaning they're not really using it. In order for you to lose the weight, you need to be using, either you're using the fat as a fuel or using carbohydrate as a fuel. And this then leads to frequent hunger, fatigue, weight gain, and carbohydrate craving due to being dependent on glucose as a fuel source. Now, treating obesity. I always say to my patient, and we have heard that there's no one size fit all approach. As individuals, we are all different with different lifestyle. So a comprehensive program that includes behavioral therapy, nutritional therapy, physical activity, and medication are the gold standard right now. Behavioral therapy focus on habit change, using different methods. If I'm going to list maybe just like monitoring or stimulus control. When we say monitoring, is maybe using things like having our client or having an individual tracking their meal, for example, to see what are the components. Or stimulus control, we'll say, for example, helping our client not to have those food that we have detected as junk food, for example, at site, cleaning their fridge, cleaning their pantry, so that they don't have that right of ready to eat when maybe there's stress and things like that. The nutritional therapy includes choices such as a low carbohydrate diet, a low fat diet, and or a Mediterranean nutrition plan. Now, Physical activity is essential for healthy communication between our organs, especially the energy regulatory, which is an important part of this journey, can be tailored based on patient health status and lifestyle. There are so many exercises out there. We're not just going to say, okay, go ahead and run, go ahead and do this. Some people may have knee problem, hip problem, back problem. They may not run. So we kind of adjust it to their lifestyle so that even if they're losing weight, they're losing it in a steady manner. So those are all the approaches. And I know in between those lines, there's a lot that we can talk about. So my goal tonight is really to open up the floor for more questions so that it can direct the direction that we all want to go and what we want to see happening. So that's the end of the slide. Thank you.
Thank you so much for that foundation in obesity. Obesity is huge. Obesity is wide. So if you take the slide down so that we can, see your face better. That would be fantastic. So if anyone have questions, you can put it in the chat box or raise your hand to ask the question. But I have one. So I get patients all the time who come to clinic and they want me to give them medication. I had one today that was asking for medication. What medication can I use to lose weight? And what should one say? How should one approach that? Because we do have medications that, help with weight loss.
Mm-hmm. So usually there's something the patient need to understand, and we all need to understand that although there's medication, because obesity is a disease, and using a medication is really helpful, but the patient also need to learn how to eat properly, because if not, at the end of the day, when they stop the medication, they might gain the weight back if they have not changed their habit. So my approach is mostly helping clients to understand their way of eating, changing their habits slowly, and then add medication to help them fulfill the goal that they're trying to achieve. But yes, medication is something that we have to use if we consider it as a disease. It's beneficial.
Thank you. Exactly what I told the patient. I actually didn't give him any medication. But, you take medication and you lose 30 pounds and then, you're going to gain it all back and more, which will cause frustration, depression, and, all those things we don't want to happen because there is no change in lifestyle. I actually recommend to my patients that if they can lose 1 pound a week, translates into 4 or 5 pounds a month. That's fantastic through lifestyle changes. And in order to do that, it is, in order to do that, you definitely have to change diet. There's a slide you showed us. I wrote this down. You have to have behavioral therapy. That's controlling craving.
The environment, making sure that those food are not there,
The foods that one should not be eaten.
And it's good to explain to patients, even with bariatric surgery, which is pretty much, we will call it a permanent way of losing weight. It is true that it is permanent, but it is permanent depending on what the patient is doing. Because even after a gastric sleeve or after a bypass surgery, you can still gain weight. I work with a bariatric surgeon, and I was following patients before and after surgery. And usually it's at the 8-month mark or 1 year that these patients start having their weight coming back, because they did not embrace the fact that although your stomach is now 20%, 80% was removed, you have the grilling, what during that time, the first month of the surgery, was helping you because it was taking time to rebuild. And the 8-month mark, usually the grilling is fully functioning, which is a good thing. It means that you're back to normal, but you're also back to being hungry. And because you're hungry, you can stretch it or you can eat the wrong food. And eating the wrong food, you will gain the weight back despite the surgery, So educating patient on the nutritional therapy is critical.
I cannot agree with you more. And before I bring Dr. Jagwe on, he has his hand raised. I just wanted to comment that in the beginning of bariatric surgery, because I was around, they did this surgery, and like you said, 8 months, 9 month mark, patient starts gaining weight again. It is not permanent. They start gaining weight, and it's more frustrating. Well, guess what? Now it's changed. My patients don't get to have this surgery for sometimes almost a year, at least 6 months. They have to go through psychiatry, nutritionists, exercise therapies. They have to start losing weight through lifestyle changes. Even if it's 3-5 pounds, it may be as minuscule as what have you. They want to see that the lifestyle change has been instituted. Patient is doing it. They're able to take off a few pounds, and then they do the bariatric surgery, and we have more success doing that. In fact, I should have brought a patient of mine here who weighed almost 900 pounds.
Wow.
I've seen her on TV, and the next time I do anything on obesity, I have to remind myself to bring her and to come share with us. Almost 900 pounds. Impressive. But she's doing much better today. And, she has to come tell her own story. So, Dr. Jagwe, kindly unmute, sir. There you go. Oh, you still muted. You muted. There you go.
Well, thank you very much for the presentation. Now, permit me to add a few things to what has been said so far. The basic of the problem that we have with weight control, one is not knowing that there should be a balance between input and output. For somebody who is very sedentary, even if you're eating normal size, but you're not burning the calories and you're not utilizing what you're, taking in, there is bound to be a way of, storing the excess calories in terms of body fat. So that's number one. Number two, there's a correlation between the introduction of the high fructose corn syrup into the food chain of America. In direct correlation of that with obesity. The epidemic of obesity in America has been, tied to the introduction of high fructose corn syrup to everything that we are buying that is being manufactured. Most of the things being manufactured that need sugar because of the cheapness of high fructose corn syrup, they are being used to sweeten almost everything, from pastries to things, confectioners, to juices, to even fries, because there is also a link between the consumption of high fructose corn syrup and addiction to it. People that are addicted to donuts and all those things that have a very high concentration of high fructose corn syrup, they seem to be difficult to control their, ingestion of those products. So even when they go through medications and all of that, if the kind of food they are eating is still rich in high fructose corn syrup, the obesity will become refractory, which means it will be uncontrollable. That's number two. Number three, from the standpoint of a dentist, most people that you see that have heavy weights, that are, obese, many of them do not have their back teeth. The reason is they have premature loss of their molars in the back, and so they are unable to chew their food properly. And since they are unable to chew their food properly, it then means they swallow and they do not have the sense of satiety. So they don't feel satisfied until they eat large volumes. And so the premature loss of the teeth in the back for chewing often predisposes people to gaining excess weight. And we have seen that, very directly correlated in dentistry, that a lot of people that are overweight don't have their back teeth. So they need it not just lifestyle, modification, but the oral health is very, very important, because we also know that those who have obesity do always have propensity to develop blood sugar, which is diabetes, type 2 diabetes, and that affects the oral health in a very adverse in a very adverse way, with gum disease and more losses of teeth, and also. It's almost like a vicious cycle for those who do not have enough number of teeth in the back and still losing it because they have obesity and diabetes type 2.
Thank you so much, sir, for that input. I have a question before I call Sister Lola to ask, to come in. You said people will lose their teeth in the back.
Mm.
That's the wisdom tooth, right?
No, not just the wisdom teeth. We're talking about the molars, the teeth for chewing.
Okay, the molars. But
Yes.
dentists take that out a lot. They're very fond of taking out the molar from people's mouth.
Dentists don't take out molars that are healthy. They take out molars that are not healthy. So in most cases, the reason most of these people lose their teeth is because they have untreated either gum disease for many years or cavities that were never treated. So if somebody has cavity in their teeth and they never got any dental work done on them to treat the cavity, the end result will be they have irreversible infection of their pulp. The irreversible situation causes them to lose their teeth. Because once they can't sleep because of toothache, they will go to the dentist and say, please take these teeth out for me, because they cannot be treated any longer, that they need to go. And if they don't take them out immediately, it means they are going to end up with septicemia, and the infection can spread to the heart, to the brain, and to the kidneys, and they eventually will still die from such untreated dental condition. Yes, the dentist will take out those teeth which are bad, but remember, many of these people, they are addicted. Well, they are addicted because they like everything that has sugar. So they are constantly eating things that have sugar, candies, soda pop, donuts, cookies, fudge, everything that is very sweet. And those are the reasons why many people develop cavities. And if they have cavities and their oral hygiene habit is not improved, they will end up with losing their teeth prematurely. So I know I've shared before that we do not have to lose any of our teeth, for even if we live to be 120 years. So we have been endowed with the ability to have our teeth, if we use them the way we should, to last us a lifetime without having anything wrong with our teeth. So yes, if anybody loses their back teeth, their molar teeth prematurely, they will have problems with food.
Thank you so much, sir.
Okay.
Again, it comes down to diet, what we eat. So, Sister Lola, kindly unmute. Thank you, sir.
Thank you so much for this presentation. My question is kind of divided into two. What role, number one, what role do the hereditary play with obesity? Number two, I've had instances of some patients also that said they try to lose weight by not eating and they're still getting weight. I like that too. I like the expansion on those two, please.
All right. I'm going to start by saying, Doctor, thank you to our favorite dentist, because what
Dr.
he just
Ajagbe.
said, Dr. Ajagbe, yes. What he said was very true. You know, unfortunately, the food industry is not here to help us. They're here to make money. If you want to go into detail, there's a lot to say just on that one topic. And talking about the teeth and the dental part and the chewing part is very important. That's also some of the technique that I use in the behavioral therapy, where I ask patients to take about 20 minutes to eat their meal, because it takes about that time for our brain to register that we are full. But most of the time when we eat faster, we don't get to that registration, and the teeth and everything get involved into it, where you're really supposed to chew your food until it's like water for you to swallow. Now, back to Ms. Lola. Hereditary is a very tiny component of weight loss, I would say. A lot of people think that can make losing weight difficult are the metabolic, like the PCOS, you know, the thyroid issue. But it really plays a very narrow role. I have seen patients who say, this is just the way we are. We have big bone. This is how we are shaped. It is totally different from the fat percentage. If you really follow the way of losing weight based on your lifestyle, you will lose weight. I don't think there's a family where they were just born to be obese, you know, to have this extra fat percentage while the other one cannot. So the percentage is very narrow. I'm not saying it's non-existent, but it really cannot affect your journey that much. And the second question was, did I put it down?
Yeah, not eating.
Not eating. Okay.
Is that, you know, some people say that they don't eat, but then they keep putting on weight.
To tell you the truth, I have seen so many patients. It's just how to approach them. Because what I have done, I have seen patients sitting on my chair and telling me, I eat healthy, Miss Sylvia. And then I will ask them to tell me what they eat. They will give me this food list over and over. And as they're talking and I'm listening to them, but they're saying they eat healthy. As I keep breaking down meal by meal, they're like, oh, I didn't know that was not healthy. So you can have somebody who's telling you that I don't eat, but they have a bag of potato chips and candy under their desk at work. That is their food. They chew on that candy the whole day. Of course, they don't eat. It's not food. So that's why we have to be very meticulous. It takes time with obesity to really sit down and have this patient giving you one by one. My consultation only usually take about an hour and 15 minutes, if not more, just to get to pour it out of them, you know? So if you don't eat, you will lose weight.
Okay, what effect does insulin play? Insulin.
The insulin?
Said, what part does insulin play?
A big one. How can I put it simple? Insulin actually is there to help us. When you eat food that are high in carbohydrate, let's say the refined carbohydrate, the insulin is coming to take it and keep it as a storage. Now, the pancreas that releases the insulin doesn't really know the amount. I'm just breaking it down, you know, so we can understand. Doesn't know the amount of sugar that just entered the bloodstream. So the insulin is sent by the pancreas. The pancreas is there. The insulin come and just take this sugar and try to metabolize it to try to go keep it. And when we say insulin resistant, there's a point where the insulin itself become tired and be like, I'm really tired if I'm going to use this, this term. Now, there's a difference between what we eat that spike the insulin more. For example, when we differentiate between the refined carbohydrate, which is the carb that you get from sugar, from pasta, from rice. You know, someone will say, but rice is food, it's good. Yeah, but it spikes your insulin. That's why when you eat something like a good bowl of rice, if you start noticing yourself, after you finish it, you're tired. And 30 minutes after, you want some little bread to go with it because of the insulin circulating in your bloodstream. So it really goes into what are we eating to spike that insulin. And it's very important because that also leads to diabetes.
Thank you very much.
You're very welcome.
So your questions are so deeply important, you know, and they all border on basically what we put in our mouth, what we eat. We've said it over and over. I think we've said on this platform, maybe not, I'm not sure. I think we have, that chips, sodas are huge culprits in weight issues. And please, Sister Lola, check out all those people who say, I don't eat, but I keep putting on weight. Check out what they eat. They snack. They snack. And the snacks are chips and their water is soda. So it depends on what one puts in one's mouth. If you put the right things in, you will lose weight. There is, you know, there are some people, it's very few, that genetics is the reason why they are obese. But even with genes, you can still eat right and feel better. You know, I was sharing with someone recently that the body is very, very sensitive and very interesting. When you start putting on weight, just watch it. You start getting tired. Your energy goes down. You start noticing that when you go up the stairs, you know, it doesn't feel as comfortable as it used to be. You have to, you know, maybe rest a little bit when you get to the top of the stairs. The body is trying to check you that, hey, I'm going where I don't want to go. If you don't take heed then and institute good lifestyle changes with great diet and exercise, and you keep going, you will just start getting more tired, you know, having less exercise tolerance, and then running from doctor to doctor to see how to treat those symptoms that it's really caused by weight. There really isn't anything doctors can do unless you lose the weight. It's a vicious cycle.
Also, Dr. O, I know some people that say, I'm scared. I don't want to check my weight on the scale. I'm like, why are you afraid? I do that almost every day just to check myself, to know what next to do, where I was, where I am, because I don't want to pass certain weight. I don't know why people are scared to get on the scale.
Because, go ahead.
Obesity is and that's why I'm saying you have to be very meticulous in approaching. In the Obesity Medicine Association, we ask permission to even talk about weight because it carries a lot of weight. When you start speaking with patients, you really figure out that it's rooted deeply. I have had patients cry because there was the first time they were sharing that their own mother spent a lifetime calling them fat. It's not a word to be used. There's a lot of low self-esteem involved. So we have to be very compassionate. There are people who have gained weight because of abuse, being beaten by their ex-husband. There are people who have gained weight. There are so many multiple reasons. And that's why the behavior, the psychotherapy part of obesity is very, very important. So the way you approach sometimes the patient can make them feel ashamed. I always introduce myself by saying to my patient that it's not their fault, because it's not just about eating or not eating. It's also about what the ghrelin, the leptin, all of these hormones are doing into you. And that's why we call it a disease. If it were just eating, it would not be called a disease. It's because of everything that intricate into it. So we have to be very, very careful. If they don't want to weigh themselves, you postpone that conversation to another time. You know, it takes some time for people to start weighing themselves just because of the shame. You know, you have been in an airplane where you see somebody coming, and this is where this passion came to me. It's not because I needed to lose more weight. It's just because I saw people not being treated. And it's very sad to say that not being treated well, even by us providers. Sometimes we shame our patient ourselves without even knowing, you know? So it's very heart touching when you speak to some of these patients. So if they're resistant, it's okay. Don't wait them. Just try to help them to understand the benefits slowly. Maybe the next time they will. You know, how knowing is a key of success. If you don't know, it's going to be hard to do it, you know. So just take time. Just take time. Something may not happen in, you know, during one visit.
Thank you. Thank you so much. Dr. Jagbe, you have your hand raised again.
Yes, let's look at a different dimension to this. I know some part of Nigeria, at least one part of Nigeria, where women are being sent to the fattening room in preparation for marriage.
The Calabas, right?
Yes. Okay. So we're talking about it being a disease, but there is a cultural norm in that part of the country or part of the world where they believe that obesity is actually the in thing, is to be desired. Now, I'm not sure whether this mindset is okay or whether there is any scientific, data to refute their assertions that is what is desirable for their own culture. I wish.
Sorry, go ahead.
So I wanted to know if there is any form, if there is anything in the literature about the fattening room in terms of health, public health. Is there anything like that documented in the literature?
When you say anything, you want to say why
I'm saying scientific. I'm talking about scientific studies that either suggest that is not a good idea for people to intentionally work towards becoming obese.
So, Dr. Jagbe, there hasn't been a research done on Calabar women and that culture. It is the culture. But there are tons of research that has shown that regardless of how you gain weight, it's a disease. Obesity, it's research that led to the fact that obesity has become a disease entity because, like we saw in one of the slides, it can cause high blood pressure, diabetes, kidney problems, and the list goes on. Inability to, exercise, to move right, shortness of breath. Look, the list goes on, what obesity causes. So regardless of how one gets there, one gets obese, it's not a good thing. But in that culture, it is fashionable. That's what the men wants. That's part of what we discussed 2 weeks ago with Attorney Akinshola and our darling sister, Dr.
Agbe.
That was what we were discussing. Because it is, to me, it is a kind of abuse. This fattening is for men. It's not because the woman feels that I'm not good enough the way I am or anything like that. is for men. It's a male society. You can laugh, you're a Nigerian man, and you can laugh. You know, in all the cultures in Nigeria, there are different ways that women are suppressed. Not just Nigeria, in Africa, maybe not just Africa, maybe all over the world. And that's why there has been different forums, different talks to help men realize that they need to ease up.
Dr.
So-
Jagwe, if we talk about Calabar woman, but you will be surprised to know that in this country, that curve that people say, men have made women, especially of color, thinking that for them to be beautiful, they need to have that curve. I have worked with patients who denied to get to a normal BMI because in the society, and we're talking about African American here, not even Calabar, they will say that they're telling them that they are sick if they continue to lose weight. Their boyfriend want to leave them because they're losing, I'm going to just use it, they're losing their butt. They don't want to lose that, regardless if it's going to cause them disease or not. They want to lose weight and stop at a certain level because they're going to be shamed, you know. And this is a country where it's kind of developed. Let's talk about our country. Let's go to Calabar. It's about education. And these women are doing that, but they just don't know how they're destroying themselves. Even here in America, we are still educating people about the disease of obesity. Can't you imagine back home? We have a lot of ground to take. There is a lot to be done. To explain to a woman that you have got to love yourself first, knowing yourself. When you do it for a man, it's like people going to add the boobs because they're doing it for a man. You shouldn't do that. You should do it for yourself if that's what you want. And if a man wants to love you like that, so be it. If not, it's what it is. But it takes a lot of education. They're killing themselves because at the end of the day, that fat is going to kill them.
Thank you. Thank you. So on the chat box, our First Lady May said, our BMI is body mass index. It is what we use to compare your height to your weight. So if you a certain height, you should weigh in a certain range. It's all BMI means, it's body mass index. So she says, are BMI numbers realistic for the average African American woman? And how often are these numbers reevaluated? You are muted. You are muted.
Yeah, it's a large debate because sometimes some provider thinks that when this BMI history started, of course, on white people, and that we have our height, we have our composition, the Asian have their own composition, but regardless of all of it, there are some basics that are the same. That when you reach that BMI of 30, you're obese. It doesn't matter if you're from Asian descent, white descent, black descent. Yes, you are. And sometimes it's about also being realistic. When you look at yourself, you know that I have put on more weight, just like you explained earlier with the way that you feel. And BMI is not only, BMI just help us to categorize obesity, but obesity have classification and stage. When you are that 30 BMI, they say you have class 1 obesity, but you can have class 1 obesity and have a stage 2 obesity, because then you already have something like hypertension or diabetes. You know, all of these chronic diseases, it just add the stages, you know, the more stages, the dangerous, you know, line you are. But when I work with a patient, for example, if I have a patient with BMI is 44, honestly, when they get to a BMI of 30, it is a huge success, because they're different from somebody who came with BMI of 31 and we're just trying to go there to 27 or 26. So it's really individual basis. But when you are 30, we call it the disease of obesity.
So how often are these numbers reevaluated?
How often?
The BMI. In my clinic, I check it every time you come in. It's part of your vitals. So if you see me today and you see me next week, my staff is going to check your height, your weight, blood pressure, pulse, temperature, thanks to COVID. Temperature is standard now that we add your pulse, respiratory rate. Those are your vitals. And they checked every time you come in. And, you know, it helps me to know if you have gained or lost weight. And so we can discuss it. So it depends on providers, really.
For me, I have patients check it at home since I focus on obesity, and it's pretty much what I do day in and day out. They measure themselves once a week, and depending on how often I'm seeing them, then I measure it in the office, and we talk about the change, we talk about the challenge. You know, there's always challenge in this eating habit, and we adjust as we go. That's basically what I do.
By the way, I want to just right here say thank you for the phenomenal work you do, for how people rave about you and how you make them feel. Please do us, Medical Mondays family, a favor by putting your information in the chat box for people who may want to consult with you. Do you do virtual?
Yes,
you
I do
do
telemedicine.
Fantastic. So kindly remember to put that in the chat box so that, you know, in case people want to, consult with you. Thank you. So this is my bro from Nigeria, Mr. Noah, Pastor Noah Ajayi. Go ahead, ask your question.
Thank you, Ma. God bless you, Ma. I want to ask, about this, our discussion, the obesity. I want to know, is there anything called natural or, through diet? I want to know if there are ones that are natural and then there are other ones that is through the diet that people used to take in. I want to know if there's something like that.
That can help them to lose weight or to gain?
No, what I mean, are there obesity that is natural? That is natural.
Okay.
Then, I want to know whether there's natural one, and then is it
food that causes it?
Or it is food.
Okay.
Then that's the first question. Then the second question, when it is being controlled, and it happened that the person changed his diet, will there be any future implication?
Excellent question.
Most especially if the person changed his diet.
Okay. Great. Go ahead.
Good question.
Yes, these are the two questions.
Very good question.
Yes.
Very, very good question. The causation is of obesity. If we just want to keep it simple, it has to do with what we eat. It has to do with the intake. I'm going to dive into African culture a little bit. Because sometimes I have seen our sister coming to see me and they're saying, I eat what I cook. So I don't understand. Because we don't understand how heavy, carb, starchy our food is. When I used to work with a bariatric surgeon, there was a patient who came, she had surgery. And she was coming all the time, bugging the doctor that she's not gaining weight. One day she came and I was there. And as she's talking to the doctor, I looked at her name. And I said, "You from Cameroon?" She said, "Yes." I said, "Okay." So I was there with Dr. King, and she was just talking to the doctor, how she's doing everything that she can, but she's not losing weight. And I asked her, "Do you have bobolo in your fridge?" She looked at me like, "What are you saying?" I said, "No." And the doctor was looking at me, "What are you asking?" I'm asking about food from back home that she have in her freezer. And that's the reason why she's not losing weight. You have cassava. You have all of this jollof rice. They're good. But we have got to start learning the composition of our food and walk into it. We will be okay. Because sometimes for us, it's not because we're eating McDonald's. No, for us, it's because we're eating, I don't even know how to say it, because there are so many Cameroonian food that I can say, but maybe you guys will not understand. Because when we use that cassava, we can make it as fufu, pounded yam, all these starches. There's so many ways of eating the beans. We eat it in different ways. Yes, beans are fiber. At the end of the day, they're heavy in carb. If you eat beans, you will sit home and get obese eating beans. You know? So, and that's what I was saying, is very individualistic. The approach when I talk to people is really based on their background, on what they do at home. How are we going to decide to eat half a cup of jollof rice instead of a whole bowl?
Okay.
Or how are we going to not eat le moi moi? I love moi moi myself. How do we eat just that small one and not eat anything else? You know, so there's a lot into it.
So what are the implications, it says, of changing one's diet?
Good. That's the second question. Changing your diet to a healthy diet is just going to keep you healthy. And with everything, if the food is not good for you, you stop eating it. Your body get adjust to that healthy habit and you feel good. If you go back to it, you'll go back to square one. But you can actually change the way you eat and keep it forever. It's about the way you do it. Some people go very drastic. It's not everyone like you wake up in the morning and do a keto diet. They will not survive. They will do it for 2 months, they will lose 20 pounds, and the next 4 months, they will be back, even with more. So it's the approach that is very important. The way you approach it, the way you lose the weight is what's going to help you to maintain in long term. I have patients that have lost 80 pounds. I have patients that have lost 100 pounds. We are maintaining, they are maintaining. I see them maybe every 3-4 months. They are maintaining. But it takes long to get to that level and have them maintain. But yes, you can maintain it.
Fantastic. And that's the way to do it. Fad diets are not the way to do it. Keto, it increases your cholesterol. It's not just the way to go. And all those fad diets. Thank you so much for that elaboration. Dr. Ajagbe, did you have your hand raised again, or there's an accident? Kindly.
Yes.
Oh, go ahead, sir.
Yes. I think the presenter mentioned self-esteem.
Yes.
One of the ways I've advised patients of mine also in the past is to ask them to write a love letter to themselves. It sounds so awkward and so, wow, me write a love letter to myself? I say yes. Because if you don't love yourself, if you think you'd love yourself without expressing it to yourself, you will never know how valuable you are to you. So, and I challenge everybody on this forum tonight to write a love letter to yourself and see how easy or how difficult it is to write a love letter to yourself. I'm not saying writing it to somebody you think you admire from afar, but to yourself, it is one of the most difficult letters to write. So, for self-esteem to improve, you must approve who you are. You must accept yourself for who you are, whether you are overweight or underweight, whatever it is. First of all, you must accept yourself for who you are, and then change what you don't like about yourself. But if you are already in the deficit because you have very low self-esteem, you hate yourself, you are always comparing yourself to other people, you look at other people and say, why can't I be as nice or as beautiful as these other people? Well, you are undermining your own progress. So you don't even need anybody to tell you you are ugly, you are fat, you are this, before many of these things develop inside each individual. And I still maintain it. Anyone who dares to take up the challenge, write a love letter to yourself and see how easy it is. Most of my patients come back to me and say, Doc, this is the most difficult thing I've ever encountered, to write a love letter to myself. I don't know what to write. I say, well, start from the way you if you love somebody, how do you express yourself to them? See yourself in that position of somebody else and love that person who is you the way you should love yourself. And you see, it's going to begin to change everything. And the other thing is, don't expect anything big because you just started changing your lifestyle and you think, oh yeah, I have to lose weight so quickly. No, take baby steps. If you take baby steps, you encourage yourself with little progress that you're making. And in the long run, they'll become cumulative. And then everybody will see you later on and say, wow, what did you do? Don't you look so gorgeous? Don't you look so nice? Well, it's because you are not in a rush. You take it in strides. Thank you.
Thank you so much. Thank you, Dr. Jago. That's very powerful. What he just said is very true. It's one of the techniques of motivational interview that I use. And it's very hard to see somebody writing themselves a love letter. Sometimes I start with just telling my patient to look into the mirror and say to themselves, I love you. And even just that is difficult. I have a patient standing in front of that mirror and just cry. It was hard for her to say it until she said it, and it changed the whole world for her. So what he's saying is very powerful. It's just obesity is so large. There's so many things that can be done that we cannot cover in one sitting like this. It's a lot, but thank you for adding that. That's very powerful. Yes, I encourage everyone to write themselves that love letter because it starts with us. Yeah.
Thank you. So, Dr. Oduyebo, thanks you for the very resourceful presentation. And he said there is enough research out there to also support that weight loss could be attributed to hormonal inconsistencies. Can you please address this?
I'm going to use two basic hormones. There are so many. There's leptin, there's ghrelin, there's insulin. All of those play a role. And that's really one of the reasons that it became a disease is because of this hormonal imbalance. An example that is something that is even hard scientifically to explain is that when you lose weight, the ghrelin is the enzyme that lives in your stomach that usually tell you that you are full, When you lose weight, someone would think that the ghrelin will decrease, but it actually increased. Don't ask me why. And those are some of the difficulty where people face when they're saying that I'm losing weight, but I am now very hungry. That's the hormone. What are you going to do? They just go opposite way. So what I have taught people is just when you get to that point is to remember that it comes as a wave. And it will go away. Yes, there is obesity, the disease part of it. There is also a mind part of it. And that's what you do. We do a lot of psycho counseling. When you're working with someone, it's not just you come and measure your BMI, you go. It's about what is going on really. When you hit this one, what do you do? But yes, those hormones, the insulin, the leptin, all of them go against us. And there's not much to do about that. You can't regulate this hormone. They have their way of functioning, they will function like that. You just need to understand them and learning how to. It's like when you're a woman and then you hit 50, for example, with those hormonal problems, you have a propensity to gain weight. And those weight distribution change because of the hormone. So you gain more of them into the stomach. What do? You're going to get there. So before you get there, you start changing your habits so that when you get there, it's going to happen, but it will be less than if you were not prepared, if you didn't do, some lifestyle changes before hitting that difficulty, because it will happen. It's hormone, can change it, can do anything about it. And that's when the medication comes sometimes, because the medication tricks the hormone to respond differently. Like you don't feel that hunger. It doesn't mean that hormone, the ghrelin is not working. The ghrelin is still doing its own job, but your brain is telling you that no, you're full.
Thank you. Dr. Tchuindjo, I hope your question was answered. If not, raise your hand or ask follow-up questions, sir. Auntie Susan said, thanks for the deep clarity on what causes obesity. Can you please tell us your view on intermittent fasting? She says she knows it works, but are there later effects?
No. We have been told as we are growing up that we have to eat breakfast. Everybody, if you don't, it's your first meal of the day. If you don't eat it, you're not going to be healthy. I'm just going to start with the definition of breakfast. It's breaking a fast. Either it's 12 hour or 16 hour, you're breaking a fast. You decide when you want to do that. Intermittent fasting is a tool that I use a lot, especially when you get into maintenance, even sometimes when you're losing. Because your body repaired itself in a cellular level when your body it doesn't have food to work on. So intermittent fasting is a great asset. Not only it decreases the calorie intake, but it helps to repair your system. When you do a 16-8, for example, which is you stop eating around 8 o'clock at night and then you eat the next day at 12. You're really doing yourself a service. Now, the danger is when you break that fast, what happened? What is your first meal and what is your meal throughout the day? Because sometimes when you break the fast in the wrong way, there is that effect of needing candy, needing chips, it's like you can replace every calorie that you didn't eat in the morning. And then at that point, it's not helping. When you're doing intermittent fasting, when I'm telling you it works and it's good for you, learn to break your meal with more protein than carbohydrate, especially refined carbohydrate. Eat some kale, some spinach, some collard green, eat things like that with some good chicken, some good turkey, and some good fish as a first meal so that you don't spike the insulin directly so high at the beginning. And it will help you because when you spike that insulin, you go into that effect of, I need more sugar. And at the end, you didn't help yourself.
Yes. Thank you. And there's no side effect. It's actually beneficial. Thank you. So Auntie Tawa said, what is thyroid hormone? Other hormones play, thyroid hormone and other hormones. I guess the question is, what role does thyroid hormone and other hormones play on weight gain? Also, what about sleep? So there are two questions there too.
Hormone, like we talk about the other hormone. When it comes to thyroid, we can rely on when we have hypothyroidism or if you have hypothyroidism. We all know that the lack of those thyroid will make you gain weight, and it's one of the symptoms to differentiate between hypo and hypothyroidism. And there's not much you can do about that. If you don't have those thyroid, that's why we take the levothyroxine and things like that to replace the hormone because they are important. Yes, you're going to have difficulty losing weight than somebody who doesn't. These are the specific case where it can be challenging to lose weight. It is doable. Just because you have the problem with that thyroid doesn't mean that now you're going to just go and say, because I'm already like this, then I'm just going to eat everything I want. You can alleviate the worsening of your condition by eating healthy. Maybe you're not going to go to a BMI of 26, but you can actually, even with that, live from a 35 to a 29, which is still very, very powerful. Now, the second question was about, I didn't write it.
The second question is, what about sleep? What does sleep has to do with it?
Very important. Lack of sleep changes your appetite regulation. If you don't sleep, it's pretty much like stress. I have said to someone, there's no difference between the lion chasing you and your boss riding you crazy or you going to bed and sleeping 2 hours. You're stressing, you're releasing the cortisol, you're not doing any good for yourself. and you will be hungry because of the fact that you're not sleeping. You're not giving your body a rest. It looks like your body is walking, even though you're laying in bed. So your body needs food. When you're awake, you want to eat. So you're closing your eye, but you're not sleeping. It really changes your appetite regulation and increase hunger. So sleeping is one of the main things that I talked about when I talk about, losing weight. We have got to cherish it.
Thank you so
Can
much.
I ask a question, please?
Please go ahead, ma. It's still your question.
Yeah, this one is actually not part of those two questions. What about the baby fats? You have babies and they say, oh, it's a baby fat, they will lose it, they will do this. And you have all these fancy, wonderful, plumpy babies. What about all their fat? What is going on with them? And those people that are grown that are saying, oh, it's baby fat, she will lose it.
Oh. You tell me when you're pregnant, when you have a baby, right?
That one. And when I would say a child, not even a baby, it starts with a baby, they're bouncing baby, then they go to like around 5, 6, 7, and they're still plump. And they say, oh, it's baby fat, they will leave it and they will lose it later.
Yeah, that is a language that we should not use, because the more we know, there's no baby fat. You're just feeding your kid with sodas, with chips. All of this high fructose corn syrup that Dr. Jagwe was talking about is not healthy. What I have learned is that when the kid is born, they don't really know the difference between the Coke that is sweet and the one that is not sweet. We are the one who really write the story of our children when it comes to food. Let them grow up, go to college, and start drinking sodas. When my kids were growing up, I think at some point they thought, like, why is mommy like this? She never buys soda. She says, no, this apple juice, all of this drink at my house. No, I didn't. When you guys grow up, you guys can go and do it. But today they thank me for that because of the way they look. If you were to feed them soda and all of this cake and all of this donut, they will gain weight. And sometimes it's addiction. They get into loving it, so that now when you decide as a mom to stop it, it becomes difficult. Because the kid will cry. I have seen kids crying about that candy and roll themselves on the floor. We started it. We as mom, family, parent, we need to try. And don't feel bad that if I don't give this soda to my kid, is it that I'm just not raising them? You love them. Who can love your kid than you? It's because you love them so much that you want to feed them well, so that when they grow up, they look like a very handsome, beautiful young lady. So no baby fat. And for us mother, after you have that baby, you can lose that weight. Exercise. Eat right. It will go away. Your stomach will be flat again. Don't let that mommy make you drink all this soup. Yeah, they do that. They force you. And then tomorrow is on you, and it's hard for you to lose. This is just a truth in our culture. We need to talk about it. Enough is enough. We can't. We die early. Every time when somebody calls me home, it's stroke, it's heart attack. Why? Why are we dying early like that? It's because of the way we eat, and we don't want to say anything about it. They drink everything, So no, the next time somebody say baby fat, tell them go to the gym, eat right. You will lose weight.
Oh, but you said something about the after birth. C-section is not easy. How do you get that lower abdominal muscles tightened up after C-section?
You need to heal after a C-section. It's not easy. It takes time to heal. But when you are healed, you can strengthen your core. There are core exercises. It's not going to happen overnight. It's going to take time compared to somebody who didn't have a C-section. Because sometimes we want to force ourselves. Don't force yourself. Give yourself a time to heal. And when you heal, you can take care of it. It's not because you have those fat, after that C-section done, a year down the road, you cannot lose them. You start doing core exercise training, doing even the vagal maneuver. holding it tight, like, those grandma used to hold it tight. Even if you're not doing anything, you'll be surprised. You'll be surprised how just holding it in, how you can flatten that abdomen. You hold it in all the time. You start with 1 second, 2 seconds, 3 seconds. Honestly, there'll be a time where you can be talking like I'm talking and you're holding it. Somebody doesn't even know that you're holding your belly down. And that on its own, powerful exercise for the core. And you just need to be patient with this journey. It's about patience. And that's why, when I have patients, I pretty much tell them, you're going to be my partner for a long time because I have to hold your hand. Not everyone is strong enough to stand up and be like, I'm going to do it. They need someone to say, you know what, to cheer you on until you get there.
Thank you.
You're
Thank you, Dr. O.
Facts. So true. Thank you, Ma. You always ask excellent questions. Thank you. But those are facts. I wanted to say something though about hypothyroidism. Hypothyroidism is when you don't have enough thyroid hormones going around your body as you should. And so I would say your thyroid hormone level is low. That's why it's hypo. When people have that, they have symptoms that seem like depression. They have tiredness, they're not sleeping well, but the weight gain associated with hypothyroidism is like maybe 5 pounds, tops 10 pounds. It's not a lot. Although I take that back, 5 to 10 pounds is a lot of weight because you start seeing differences in, the glucose, blood pressure when you gain that 5 pounds. You gain another 5, you see the jump again. So it is quite a bit, but it's not like 30, 50 pounds that people think. Hypothyroidism does not do that. Now, hyperthyroidism, the other swing, causes weight loss. So just to, say a little bit more about the thyroid hormone. And so, Andita, I hope I delved a little bit further into that for you. You're muted.
Yes, you did. Thank you very much.
Thank you, ma'am. Thank you. So, Attorney Williams said, is it appropriate to use one standard, for example, BMI, or the height/weight ratio to measure proper weight for all people in the world?
It would be a basic answer because it is in the works. The Obesity Medicine Association, we have been fighting about those to be changed. But you guys know in America, it doesn't change like that because we believe that just the BMI shouldn't be the only way to classify the disease. Yes, we should be using things like ratio and things like that, but it is on the world. There's so many studies out there. Nothing have changed. Nothing have been improved. So as of now, we're using the BMI, unfortunately.
Yeah, we use the BMI, objectively. Because in medicine, there are several components to what we look at to take care of a patient every visit. There's the subjective part, which is what you tell us, and there's the objective part, what we see. So objectively, yes, BMI is the only thing, we look at, and the single weight. So if you see somebody, even without knowing their BMI, if they 5'3" and they weigh 200 pounds, come on, that there's a problem. So weight itself is another objective measure that we use. Another thing we use is what we call the truncal obesity. That's the, weight around the stomach. Weight around the stomach is so bad that it has a name by itself, truncal obesity. Mm-hmm. Because it's the one that causes all the problems that we talked about. The blood sugar problem, the high blood pressure problem. Your weight in your arms and your legs are not the ones that do that. Or your behind, they're not the ones that do that. Dr. Jagbe, the ones that the Calabar women are putting on and the one in the chest, those are not the ones that cause the problem. It's the truncal obesity, the weight around the abdomen. So if somebody comes in and they have this big abdomen, you know, they would come in. Attorney Williams, sir, they're coming in complaining of burning in the chest. When they lay down, they can't, you know, they can't sleep because there's this burning in their chest. And sometimes they even start coughing. They're coming in complaining of the fact that they cannot go up the stairs. They're short of breath. Their exercise tolerance has gone down. Those are all measures we use to identify weight that needs to be taken off.
Yeah.
I hope
What she says is really true. Thank you so much. It's just not that we call it a standard, but honestly, when you talk about the Endocrinology Society, the waist to hip ratio is one of the components that is very important. I measure them all the time, the neck circumference, you know, I measure all of that because just that hip to waist ratio, the number that it gives you can tell you how this person can end up with all those metabolic diseases. So we use all of those things. It's just that in the book and in the, you know, standard things, they have not been, but yes, like, you know, Dr. O is saying, so true.
So, Dr. Ajagbe, you have your hand raised, sir. Kindly, thank you.
Well, Mrs. Drew Jaye already raised the issue of sleep. I was about to address that regarding sleep apnea. That one of the downside to sleep apnea is weight gain, and exactly the way Dr. Sylvia has explained is what happens. The appetite shifts. So there's increased craving for sugary food, and most of the time, they are craving things like donuts and things that are refined carbohydrates, and that essentially is loaded with high fructose corn syrup, and that causes the addiction, and the vicious cycle continues. Once they gain weight, they're already obese, and they gain more weight. Their neck circumference is so big that the airway is compromised. So there is no way they can sleep without having sleep apnea. And that causes a whole lot of side effects as well, or complications, let's put it that way, because they're going to develop, refractory, uncontrollable high blood pressure. Diabetes is also going to be uncontrolled. And all of these things are going to further take them down the wrong path. And so sleep is very, very important. Now, if somebody is obese, I think one of the additional things to check is to check their sleep pattern. They should do the sleep assessment test. They should find out, clinically, they should be tested. At least a questionnaire should be done to do their sleep assessment to know whether they have excessive daytime sleepiness. If the excessive daytime sleepiness has to do with the fact that they didn't sleep well at night, and then they need to have their sleep test done to rule out the sleep apnea. So, because you can give all the medications, you can do the lifestyle changes. If the sleep apnea is still untreated, it's going to be a vicious cycle. You're going to go back to the same thing that you're trying to treat. That's one. The other thing is the emphasis on exercise, needs to be made very, clearly that exercise is very, very important in this fight against obesity. And there's really no way to minimize it. And we know that most of the people that have obesity has been a primary problem also will have things like arthritis. And once they have arthritis, it's downhill from that point on, because they will become more sedentary and they will eat more and they'll gain more weight. and getting up is going to be, mobility is going to be difficult. So some of these things have to be addressed in a comprehensive manner so that we can truly see the effect of all the efforts of the clinicians on these patients.
Thank you so much, sir. Thank you. Excellent. I'm happy that you brought all of this up, and we've discussed sleep apnea in the past and associated it with obesity. And you have, directed us to where we can get sleep studies done in our bed easily. We just put in, that ring on the finger. I got my, because I'm not a hypocrite. I did, thanks to Dr. Ajagbe. Again, if you need to get your sleep study done, actually, Dr. Ajagbe is still a resource, is there, and we can do that. Again, Sylvia, giving this talk today was like, oh my gosh, I can only talk about the basics. This is huge. Obesity is huge. And she's like, oh my gosh, almost asking for, let's break it down to different components. Because of course, these are all the workups that will be done when somebody is being evaluated for treatment of obesity. It is a treatment. The lifestyle changes, working through all of that, it is a treatment, and it is very important. Look at our contact in the chat box, or reach out to me like you normally do, and I would have the contact information to give to you so that you can have a healthier life if you've been struggling with this weight loss. Dr. Fawale, thank you, sir. Dr. Jagbe. Dr. Fawale, kindly unmute. You have your hand raised. You're still muted.
Okay. Thank you.
Thank you.
Everyone for this wonderful information. The question that I want to ask is about this opera, what is it? The opera gel, whatever it's called, that they're announcing on television that this helps you to lose weight very quickly and is very effective. You even have some doctors that will vouch for it. I think there's another one besides the opera one. Yes, Omega XL. I think I listened to that yesterday. And I was just wondering, what is your take on this kind of, I mean, I know they're advertisement, but we all hear it. And if you're going through these problems of obesity, which is really a big, huge problem for a lot of us, even when we look at statistics in Nigeria, for Nigerians in Nigeria and in diaspora, the statistics is not good. It's 1 out of 5, the last time I checked, that are suffering from obesity. So when we hear a quick fix it, then you have the tendency to want to check it out. What is your take on that?
I believe in the foundation, the fundamental of the root of where the disease is coming from. We treat the root, and then the cosmetic part of it comes. There are different things that people do to liposuction, to remove those fat. There are so many. The biofreeze, they use the freezing stuff to do. They use the burning. There are so many machines. I have done it myself, trying to do and see. Sometimes you burn those fat, even when you go to see these people that have those big machines where they put on your stomach and then I'm just losing the word. We use it, we go in circle, it burns all the fat. It burns those that are there, but you create them afterwards. It doesn't burn the fact that you will never create those fat cells again. You will recreate them. So honestly, at the core, it's taking your time and change your habit. Now, when somebody go to surgery, after surgery, when they have flap skin because they have lost a lot of weight, I'm all for it. See a cosmetic surgeon because you have done the work. Now that you have done the work and it's just the skin, remove it, fix it. It's okay. But don't do the opposite. Like you can use all of this machine to do that quick fix. I guarantee you, it's coming right back. You will recreate those fat cells. The habit is a fundamental. The other one is just to beautify it. But I'd rather you take time. I usually say to my patient, the most important things for me is that when we drop out 1 pound, that we don't pick it back up. It doesn't matter if it's just 1, because I know what 1 means when it comes to your health. Quick fix is not the way to go. Take your time. I always say to my patient, you need to, like Dr. Ajagi was saying, to know that you are beautiful regardless. And the fact that you're even thinking about taking care of yourself to remove that weight, it's already 50% success. But in the core of your creation, you are God's creation, and He needs you beautifully. That means you are beautiful to start with, no matter what anyone say. You're just taking care of it because He, even the God that created us, wants us to be mindful. If our body is a temple, then we need to take care of that temple. That's how I conclude these things. You take care of it, but don't let it be like, oh, am I looking good? Am I looking? No, you're amazing. Just take your time. That's all I would say.
Thank you so much. And you know what? Even if I can speak for her, she believes exactly what you believe, because I've been on Health Forum with her, Health Matters, and she looks amazing. She looks fabulous. You can see our weight loss can glowing from lifestyle change, doing this. And I know what she cooks because she posts on the forum. Oh my gosh, it's amazing. So Pastor Dr. Fawole, thank you.
Thank you. I know I've had a lot of our people, from Nigeria, they will try to do this and try to do all that. And I mean, I'm not a medical doctor, but that quick fix it will never be the way. It will never be the way. But then it sounds really good when you hear all this. This is upright gel. I took it within 2 weeks, I already lost 50 pounds. And when you're really struggling, then you want to run for it and say, hey, let me try that, maybe. But, a forum like this that educate us that you're just damaging yourself instead of helping yourself, hopefully will help us, to choose better. Thank you.
Thank you. Thank you. Thank you. So there's another question. I think this may be the last one. Does bone density affect BMI? Yes, it does.
That's what I'm going to say. It's the core definition of BMI. Really, it's the bone density. So yes, it affected.
Does. All in all, my take home here is healthy eating, exercising, and, balancing things. I don't think we would have done complete justice if we don't talk about stress eating. A lot of people are going through stuff at home. Husband and wives, they present this face like everything is great, hunky-dory, and it's a lie. The man is suffering from the hand of the woman, or the woman is suffering from the hands of the man. And what do they turn to? Food. And what you see as a result, obesity, and that is difficult. If that is not taken care of, please help us with that.
Yes.
I see a lot of stress.
Yes, it's very important because sometimes, like we were saying, Sakosho, we don't understand how it plays a big role on our our body and things like that. I usually say that just like you have a relationship with your son, with your daughter, with your husband, we do have a relationship with food. So when you're going through stress, food become your friend. Just think about it. You don't wake up one morning and say to your good best friend that I don't want you in my life anymore. So it's a huge problem because that food that have become your best friend. You're not just going to say move. You guys need to have conversation. And in those conversations, you need to be telling that relationship that I'm the owner. So you're going to have to listen to me a little bit. And that's a long fight. And that's what stress and abuse and all of that cause. Because you turn for comfort. That's your baby. And it's really hard to just get rid of it. And this one goes into, we have to be patient. But recognizing those patterns are very important. If you don't know, you don't know. But if you can sit down, look into yourself and be like, you know what, I have a relationship with food. Food is my best friend. How are we going to do this? How are we going to separate? How are we going to divorce? It's a lot of talking back and forth with food. Honestly, it sounds crazy. But yes, you have to talk to that food. You have to go to the store and be like, no, I'm not going to buy you. You don't work for me. I work for you. I go to work, I punch in, I see 10,000 patients, I charge, I make the money. You're not going to do that. I'm going to be the one going to buy that veggie. I'm not buying that candy today. You leave me alone. There's a lot of talking in that relationship, and it's not easy.
Wow. Thank you so much. I've never heard it put that way before. Really appreciate you. Thank you for coming to Medical Mondays with Dr. O. And I want to remind us that what we have done tonight, as we normally do, is share important information to better our health. We are not establishing patient or physician-patient relationship. We're sharing information. However, Mr. Sylvia's information is in the chat box again, or you can reach out to me if you need her to help you along with the weight loss journey. We have done here on this platform plant-based diet, the natural ways of, attacking excess weight. And, this is the other part of how to do it, and we get results, also. Pastor Dr. Fawale, Attorney Akinshola, Auntie Tower, I'm mentioning names of those that are here that we've got, Dr. V, Dr. Veronica, and a lot more of us have gone through the Health Matters program, where we have learned how to eat right, exercise. Our First Lady, May, also has done that. Yes. And we have learned a lot of things in the process, but you know what? To eat it home, Sylvia is the place to do that, because that's the person who will hold your hand through this. So there's a question about insurance. Yes, she accepts insurance. Your insurance pays for this. And she can do it virtually. I'm excited because for me, this forum is about us all getting healthy, being in excellent health, and averting all those, medical issues that have been arising in our communities recently. So if you have any further questions, you can ask through email, WhatsApp. Oh, don't do WhatsApp. I may miss it. But if you do email, I won't. And so without much ado, I'm going to say ciao. See you next week, if Christ tarries. And stay tuned for Dr. Ezugu. Our very own Dr. Ezugu is coming next week. A cardiologist is coming to talk to us about, should I tell? No, I'm not going to let the cat out of the box. Stay tuned, okay? And next week we will have Dr.